Okay, please start.
Yes, Dr. Henna, am I supposed to tell my patient that I am a resident doctor over here? Or like,
Yes.
okay, fine. There is some other sounds coming from behind.
Is it clear now?
No, there is still some sound. Anyway, I can listen to you.
Wait just a minute, I will check again. Now is it clear?
Yes, it's clear.
Okay.
Okay, we start?
Yes.
Okay, it's my very first time, and last time I attended, and this time I want to participate. So I hope it will be okay. Anyway, we're starting.
Yeah.
Hello, my name is Dr. Shahla Faridun, and I am your resident doctor here in this hospital. May I know your name, please?
My name is Alexander.
Hello, Alexandra.
Hello, doctor.
Please have a seat.
Thank you, doctor.
Alexandra, I've just been through your record, all of your history you gave, that you're working as an accountant in a company. Am I right?
Yes, doctor.
Okay, and as per your weight and as per your daily routine, it's evident from that you are not being into a regular exercise, but you have lost some weight recently. And others record, if I can see that you are feeling tired and you have some problem in your vision. Is that right?
Yes, doctor.
You want to tell me something else about your problems?
No, doctor. I'm just unable to read, and and for that, I think so. I need some kind of reading glasses, and my spouse just told me that I should go and see you. So, could you please do the eye examination as I need prescription lenses?
Okay, so do you have a problem in reading? Do you have any other problem like seeing from a distance, or is it okay?
Yes, it's fine, doctor. But my vision is quite blur than usual nowadays.
Okay, you are a diabetic as well.
No, doctor. I'm not diabetic, and have never been diagnosed as a case of diabetes.
Okay, you have any problem like feeling tired, you have any problem like feeling thirsty all the time, you want to drink more water, or you have any other conditions you want to tell me?
No, doctor. I don't have any such medical condition, and I'm not taking any medication. But yes, I do
Okay.
feel thirsty.
Okay, so as per all the record I have been through, I would like to have a diabetic test for you. I think that is good. We should go for a random blood glucose test for you. It's a simple test. It's just a finger prick, a small prick, and it's a very straightforward test. You can get your result just within a few minutes. Do you agree with me?
Doctor,
I
why
think that
you're
is
suggesting me to go for a diabetes test?
That is because you have weight problem. You are kind of overweight, and you have recently lost some weight. At the same time, your sedentary lifestyle, like you are not doing any exercises, and at the same time you're feeling tired and you have vision problems and you're feeling thirsty. I think these things. I think these all these symptoms are suggestive of diabetes, and the same time you have this problem with the vision, so diabetes can affect your vision. It's better to be diagnosed in time, and it's better to be treated in time, and it will be good for you, as far as I think.
Well, doctor, cannot believe that you're saying that I'm having diabetes. And this diabetes is causing the vision problems. That's very um, you know I cannot believe this.
Well, it's a very simple test. Let's be sure. It's just to find out the cause. If it is not the cause, then we can just simply recommend you. You can refer you to the ophthalmologist, and he can just check your vision, and he can prescribe you, even if it is diabetes. And the treatment of diabetes is very simple these days. It's quite effective. you can get anti-diabetic treatment in the form of oral medication, or you can take insulin, whatever is suitable for you, that would be prescribed by the endocrinologist if it is. So my suggestion would be to undergo these tests. If it is not like that, then you can simply go to an ophthalmologist and get tested your vision and get your glasses.
Well, doctor, I need reading classes. I do not want to go for all these testings and all. I think so. You're
Well,
just, you're just over testing me, or you're just
no,
being.
no, it would. No, I can understand your worries. That's like for first time when you come to know all of a sudden somebody tell you this. But I want to be sure. I want this is for the benefit of you. If it is get tested in time in order to, save you from other complications, it's the best to get treated, to get diagnosed in time and get started treating. It would be very good for you. Diabetes control, because diabetes is a treatment you have to it's a disease, you have to keep it in control, and you can be saved from a lot of complications.
Okay, doctor, if you say so.
Okay, thank you. I will refer you to the ophthalmologist. Before that, I have to do your random blood tests, and if there is any problem, then accordingly I will refer you to the endocrinologist. If that is okay, then I will just refer you to the ophthalmologist. Okay.
Okay, doctor. Thank you, doctor.
Okay, thank you. Have a nice day.
Okay, your name is Shaila, right?
Yes, my name is Shala.
Okay, so anyone else want to do this card?
I want to do it.
Your name's Samia, right?
Yes, yes.
Okay. Do you need time to read, or you just start?
Yeah, I read it. We can start.
Okay,
I did
just
it
start.
actually last time, but I want to improve my speaking skills. Yes.
Okay. So we will
Okay.
start because there are many mistakes that Shaila has
I will
done.
start.
So yes, you start. So after that, I will just let you know your mistakes. If anyone else want to do the card, just stand by. So we will do rapidly. Okay. Okay. So Samia, start.
Okay. Okay. Hello, my name is Dr. Samiha, and I'm a resident working here in the clinic. How are you, and what is your name?
Well, doctor, I'm fine, and my name is Peter.
Okay. Peter, make yourself comfortable.
Okay, doctor.
Okay. Peter, I was informed about the complaints that the reason for your visit that you have come here. Is it true that you are working in a company and you are quite busy in your work,
Yes,
which is
doctor.
making you feel tired?
Yes, doctor.
Okay. And okay. And also that you are also having weight loss and you are having some problems in your vision, which is getting you concerned.
Yes, doctor.
Okay. And this is also the reason that you have been visited by your spouse who has encouraged you to visit me. Am I right?
Yes.
Okay. So what is the thing, the main concern that has made you come to the clinic?
Well, I just want to get my eyes tested. Because I need prescription lenses because I'm having some kind of a difficulty while reading classes. While reading.
Okay. So is it only because of this? And what about I noticed that the other complaints that you are feeling are also recent, right?
What kind of complaints, doctor?
Like you said about weight loss and the problems in the vision, and also so I'm feeling that this is not the only thing, the recent thing, the weight loss and feeling tired, this is also recent, isn't it?
Yes, doctor.
Yeah, so you are having any other symptoms along with it, any other things that you have to go frequently to the bathroom is for urination, or you are feeling thirsty a lot, is anything like this
No, doctor.
happening?
Not such.
Okay. But because of the recent weight loss and all the other things, I would like for you to get also tested for diabetes.
Oh, well, doctor, why? You are testing me for
Uh,
diabetes.
Yeah, because you see, nowadays, and because of the stress and because of your age, and because before now you are having a demanding job and the weight loss associated with the vision problems that you are facing, I feel that there is no harm in getting you tested for diabetes. And actually, it will prevent you from any more future complications if we get it tested and if we find out it out early.
Well, doctor, I cannot believe that you are thinking that my blurring of vision or, I'm having this difficulty of reading. So that's caused by diabetes. I think so. You are overthinking and you are over-testing me. I just simply need reading glasses. That's it, doctor.
Yeah, actually, this will not be an expensive testing. This will be a finger prick test, which will let us know about your blood sugar, random blood sugar, and it will also help you. It will not affect your vision test that you want to get yourself tested for the vision. There is no harm in it to get yourself tested side by side, because you are 58 years old, okay, and there is no harm in getting tested for it. And it's there is no over testing because it is just a one test, a finger prick test.
Okay, doctor.
Okay, so along with the this prick test, okay, because there is I will also refer to you an ophthalmologist. Okay, but please don't forget to get yourself tested for random blood sugar.
Okay, doctor.
Okay.
Thank you, doctor. Okay,
Okay.
so what? Okay, Varda, so you raised your hand. So you want to do?
Yeah, sure.
Okay, start.
Okay. Hello, good morning. I'm Dr. Zane, one of the physician on duty. How would you like me to address you today?
You can call me Peter.
Nice to meet you, Peter. So, Peter, as I understand, you are here because you have been feeling some difficulty in your vision recently. Am I right?
Yes, doctor.
Mm-hmm. So, Peter, I was looking at your medical history, and it seems like you are being feeling tired recently, and then you have lost few kilograms. And you are also feeling overworked sometimes because of long hours on your computer. Am I right?
Yes, doctor.
Mm-hmm. So, Peter, can you tell me more about your blurry vision? How long you have been feeling like that?
For a short period of time, doctor, and I'm here just to get my eyes tested because my spouse just told me that it's better to go and visit the doctor.
Mm-hmm. I'm glad, Peter, that you took out some time and you came here to share your concern with me. So, according to Peter, what we have discussed, it seems like you have a medical condition we call diabetes mellitus. And I would highly recommend you to go for testing, which will include a random blood glucose test, which will be done through a simple finger prick. So, how do you feel about it?
Well, doctor, I don't think so. I need any kind of a diabetes test. Are you saying that the blurring of my vision or, I'm having this
Mhm.
difficulty in reading is just because of diabetes? Are you assuming that?
I can really understand your concern, Peter. It's quite natural to feel anxious about these things, but according to what we have discussed, it seems like you have positive risk factors for diabetes, being overweight and feeling tired since a long time, and then this with your blurry vision, it all suggestive of diabetes. And it's better if we could diagnose it on the earlier stages because later on we will be able to resolve all the complications and we would be able to control the disease on very early stage. Um, so, so what are your views on that?
Well, doctor, I just need a simple reading glasses. I'm thinking, I think that you are overthinking or overreacting. I just need
Mhm.
glasses. So kindly just check my eyes and give me the
Mhm.
prescription lenses.
Mhm. I can see, Peter, that you are very concerned about your blurry vision. So how about if we undergo testing for the diabetes today, and simultaneously I will refer you to an eye doctor, an ophthalmologist, just to check your eyes. So is that something you would like to do?
I don't like to do anything, doctor.
Mm-hmm. Okay. So Peter, it's just a simple test. We just have to go for a simple finger prick that will not consume more than like 5 minutes. And if we do it on very early stages, it would definitely help us to control your symptoms timely. So I would highly recommend to go for the testing for diabetes. And I know that you are concerned about your blurry vision as well. So how about if I also refer you to an eye doctor so that you can have a complete checkup for your eye? And if the ophthalmologist thinks that you have some problem with your vision or you need an eyeglasses, then he would definitely recommend that.
Okay, doctor. Sure.
Hmm. Thank you so much, Peter, for coming in here today.
Okay, thank you, doctor.
Thank you.
So anyone else want to do the card? Anyone else? Okay. No one wants to do, so I will just tell the mistakes. Now, all three of you did the same mistake by assuming the patient is here for this reason. All three of you didn't introduce yourself properly. Your introduction was not proper. Okay, and all three of you assumed that, okay, fine, the patient is here because he is having this. No, how do you know the patient is here for that? This is not plab. You are a doctor. Ask the patient that why are you here? This is not any kind of a medical history or in a hospital. Even though if the patient is, if you would go to the hospital in daily lives, the patient doesn't start assuming everything. Okay, fine, that you are working on the computer, you are losing your eyesight. No, how does the doctor know that? Like no one knows that. Even if you're having a file, the nurse will only take your vitals, the weight, blood pressure, anything. She will not take all your history or something and just give to doctor. No, हमारी डेली लाइफ में भी ऐसा नहीं होता. हम अगर किसी भी हॉस्पिटल में जाते हैं तो हमारी डेली लाइफ में ऐसा नहीं होता कि हमारे पास डॉक्टर बैठा हुआ वो कहता अच्छा ठीक है आपके पास सर में दर्द था आपके रेडिएशन ऑफ पेन भी हो रहा था आप 2-2 घंटे हॉस्पिटल में बैठते थे आप अच्छा ये काम करती हैं आप वो काम करती हैं. नो, we tell the doctor the history. Now starting with Shela, she said okay, have a seat. So it's scripted. जो एग्जामिनर है वो सीट पे ही बैठा हुआ होगा, वो आपके पास एंटर होके अंदर नहीं आ रहा होगा, आप एंटर होके रूम में जाओगी. So he will be seated. Okay, so avoid these kind of scripted sentences. Okay, have a seat, make and then Samiha said okay fine, make yourself comfortable. The patient or doctor is always there. You can make a proper introduction by saying, okay, hello, good afternoon, or good evening. I am Dr. This, and yes, I am your resident doctor. Okay, and who said, okay, yes, Shaila said, okay, I'm your resident doctor. No, you're not that person's doctor. No, you are a doctor working in that setup in this suburban clinic. Either you are a resident, either you are a general physician, either you are a doctor. You are a doctor. You are not that for the patient's personal doctor that you just use this word. Okay, I'm your. Okay, and yeah, the grammatical mistakes which you made, you were repeating Shella in time, and in time. It's always on time. It's better to get yourself treated on time, test on time, this, that, not in time. And you were just focusing on the treatment. You were just, you even started telling the treatment of diabetes. That's nowhere written in the card. Shella, okay, fine, that you will tell the treatment for diabetes. Then again, when I asked you in the task 3, I asked you that I simply need reading glasses. That's it. And there was not a proper answer for that. You were again stressing me to get myself tested for the diabetes. I just asked that I need, a simple reading classes and I do not want to go the testes, but you were convincing me. You didn't give me a proper answer for that. And you didn't do your task number 3. You didn't do that. You didn't use that. And while I was talking, you interrupted twice. You were in so much hurry that you were interrupting. Interruption will lead to a negative point. Okay. And again, diabetes control, you were talking about diabetes control, testing and all. It's not mentioned in the card. Nothing is mentioned in the card. What was mentioned in the card, you was not going with that. You were just, going here and then doing everything which was not mentioned in the card. Okay. Now again, Samia, there was no proper introduction. And, make yourself comfortable. That's scripted. And again, you started making assumptions that, okay, patient is here. He has lost a few kgs. Okay, this, that. And you use the word, okay, having difficulty in going to the bathroom. No, you have to be professional. This is your English test. You have to be formal. You have to be professional. Your language should be that. Okay, fine. How many times a day do you go to the washroom? Or how many times a day do you go for urination? Okay, how many cups or, do you feel thirsty? Is there any kind of urgency for going to the washroom? Okay, if there is any urge to pee again and again. Again, visited by your spouse and she told you to visit me. This was not making a sense. Like, who visited who and why? Why he visited his spouse? Husband and wife should be living together. So that was also not correct. Okay, fine, that you visited. You visited by your spouse and then you are visiting me. Okay, and again, what you were doing, you were convincing me for the testing. Okay, just get yourself tested, just get yourself tested, just get yourself tested. And again, the task 3, you didn't do the task 3. When I was asking also, you didn't do your task 3. Moreover, both of you, even Verda also, all 3 of you were stressing to get myself tested. That's it. Like, in the task, it's not only that to get the self-tested, that's the last one. Okay. And this to convince the patient or something like that. And in Verda also, there was no proper introduction. Okay. And again, you just start the card and came to direct to the point. Okay, fine, you just start and started talking about diabetes. And again, and if we just caught the disease early, or we just detect the disease early, we will be able to resolve that. You are not going to resolve the disease over here. They are not talking about that. Just read your task properly and completely. And then again, you were stressing on diabetes. Okay. And is there anything you like to do? Like, what am I supposed to do? Like, what does question mean? I don't understand. Like, what I'm going to do? Like, what do you want me to do? So this was an unnecessary, and all 3 of you didn't have a good signposting. Like, you didn't close the card on a proper note. If it's written, okay, if I just read your card, it's written, okay, your patient is 58-year-old company accountant with a demanding job. He or she is overweight and does not exercise regularly. Okay. Recently, your patient has been feeling unusually tired and has lost few kgs and has having blurry of the vision. The patient feels overworked and thinks that the long hours on the computer are causing the eye strain, and he or she needs reading glasses. Your patient's spouse urged him to see the doctor about the eyes issue. Okay, this is the background. So if you will just go with this for okay, fine. It must be a familiar patient. You already know about this patient, but you know about this patient because he is your regular patient. That's it. Or you are the GP of that patient. Rest, what's happening in his life, you don't know. And yes, Shaila just said in the beginning, okay, you are a known case or you have been diagnosed with diabetes. No, I was not diagnosed. Like, you just misinterpreted the card. You were unable to understand the simple English, and it will lead to minus points. That nowhere in this card is written that the patient is diabetic or has been diagnosed with diabetes. No, nothing is written there. Nothing is mentioned.
Okay.
But you assumed and you just told me that, okay, fine, I am diabetic, and for which I said, no, I have never been, diagnosed or had been treated for diabetes. Okay. Then your first task was explain that the blood vision might be the cause of diabetes. So you will ask the patient. simply ask the patient, okay, why are you here? So after the patient will tell you, okay, fine, I'm having this question, you will dig in some history. Okay, are you feeling this? Then you will say, okay, it seems like the blurring of the vision might be due to diabetes. Okay, you can also say, okay, it's a written explain. So you will explain. These are very common features, symptom of diabetes. It initially starts with this, and it's very common in the age group of, 50 to 60 people. And having sedentary lifestyle, long working hours, or stressful life. But all this, you will ask the patient. Then you will be able to know, okay, fine. Then you will say, okay, it might be. It's not like, okay, fine, you are having diabetes, and then you will say, well, so I would like to recommend you. Okay, so that we just go for a random blood glucose finger prick test. It's a very small test. It will be done in few minutes. Take care in my office, and the results will be with us. So we will get to know the cause of your underlying cause of your blurring vision. Or if I just, tiredness, blurring vision, whatever I have said to you, then you will do your next task. And again, it's to reassure the patient that the tests are straightforward. Then you will say, okay, fine, let me reassure you. There is nothing to be worried about. The tests are simple. It will be done in my clinic, in my office. And the results we will get in 10 to 15 minutes, or within a minute, we will be able to know the disease or the sugar level. You just have to do that. It's a small test. Take a non-invasive test. You can use these kind of language. Look, it's non-invasive. Okay, whatever. Then again, explain why you need to do, why you think it might be diabetes. Then this risk factors. Then I will say, okay, fine. I need simple this, or I just say, okay, I express disbelief. Okay, then you will say, okay, fine, I understand your concern. Like in all three of you, there were no empathic sentences. There was no empathy. There was no IPS. There was no patient relationship building. There was nothing. No one was, addressing that. Okay, then you will say, okay, fine, I understand your concern. But as you are having this positive family history, or whatever, the history of, as you are overweight, or you have gained some weight, you have having a sedentary lifestyle, you sit all day long in front of the computer, you do not get the time to do exercise during your busy schedule. Moreover, you have also started feeling tiredness, and you're having blurry vision for last few days, and you have also lost your weight. So these are the factors, or these are the symptoms of diabetes. That is why I'm assuming that your blurring of vision is also the cause of diabetes. That is why I want you to get tested. It's for your betterment. If we just get to know about diabetes at this moment, so we can treat it accordingly. Otherwise, you can just convince the patient. Okay, you have to convince the patient using this information. Otherwise, even if you're going, then okay, fine, you will just finish here. Then okay, then I will refuse. I just need reading classes. Then again, your empathic sentence will come. Okay, I understand. I appreciate, or I can see that you just came here to get your eyes tested because you need reading classes, because you are having difficulty in reading. I understand that. But as I'm assuming that you might be having these symptoms because of diabetes, so it's better to get tested so we can start treating the diabetes. Because even if you get the glasses, the blurring of vision will not subside. Your vision will be decreasing in future just because of diabetes. And you are having a very strong, this factors, or predisposing factors you are present, whatever you want to say, you will just say at that time. Then again, recommend a referral to the ophthalmologist and try to convince the patient for undergoing the testing for it. Okay, then I will say, okay, no, I just simply need reading glasses. Okay, Mr. Peter, and none of you addressed me with my name. At least when you are doing a card, 2 times address with at least 2 or 3 times address me with my name. Okay, so you can simply say, okay, I will make a referral to an ophthalmologist. So you can just go and you get your eyes tested. Apart from that, you can use correctors also. Apart from that, I would like you to get yourself tested for diabetes, because I think that you are having, you might be having diabetes, but as your health is my first priority, and I want to, better, good for you, something like that, whatever you want to say. You have to be empathic at that time. You have to convince the patient. None of you tried convincing me. You simply said, okay, fine, I will make a referral. That's it. And in the end also, none of you just make a good, okay, fine, Mr. Peter, here is a leaflet which contains all the, information about diabetes, and take it, and what are the signs and symptoms of diabetes. So you can just read at home and come back when you feel comfortable to get yourself tested for diabetes. Because these symptoms, your symptoms that you're experiencing now, or the problems, the issues that you're feeling now will just get worse with time, from time to time, if you're not started treating now for diabetes, something like that. You will just convince, and then you will end the cards. Then you will say, okay, have a nice day, see you again, Mr. Peter, yeah, or whatever. If you don't want to say, okay, fine, see you again, you say, have a nice day. Then you will say, okay, goodbye, thank you. In this proper way, you are going to end the card also. But don't make the major mistakes all three of you did, was you were making assumptions, okay, fine, the patient is having diabetes. You were making assumptions, okay, the fine patient is here for this complaints. How do you know about the complaints? I didn't tell you anything. You didn't ask me anything. Like, ऊपर से वही तो नहीं आ रही ना, क्योंकि फाइन ये बंदी इस चीज के लिए आई है. No, you have to be straightforward. You have to ask the patient, okay, why you are here. And don't use these kind of script sentences, okay, please come inside, have a seat, make yourself comfortable, okay, this, that. No, and give a proper introduction. And if this was your patient, so the introduction will be different. You will introduce, you will give your introduction by addressing my name. Okay, hello, Mr. Peter, it's pleasure meeting you again. Hello, Mr. Peter, good afternoon. It's nice to see you again. As you already know that I'm Dr. Hina, one of the treating physicians in this suburban clinic. So how may I help you today? What's brought you here today? Yeah, may I know the reason of your visit, please? Or how you're doing so far? But there is nothing I have been treated or I'm feeling unwell. So you will not ask, okay, how you're feeling so far? Because I'm all right. Like, मेरे में कहीं नहीं लिखा कोई chronic disease का patient हूँ या कुछ हूँ, मैं यहाँ पे आई हूँ उसी के लिए follow up के लिए आई हूँ, या फिर मैं कोई blood test के लिए आई हूँ. No, so far वाला sentence नहीं आएगा इसके अंदर. लेकिन आप लोगों ने, किसने, I think समीहा ने पूछा था, या शैला ने, किसी एक ने पूछा था कि how you feeling so far? No, मैं सही हूँ. मैं आपके पास सही आई हूँ, लेकिन मैं योर पेशेंट हूँ. इसका मतलब है क्योंकि यूके में, कनाडा में, अमेरिका में आपके एक फैमिली डॉक्टर्स होते हैं. ओके, सो वो आपके फैमिली डॉक्टर्स होते हैं, तो आपके योर होते हैं, तो उनके पास आपकी पूरी हिस्ट्री होती है. इधर ऐसा कोई मेरी मेडिकल हिस्ट्री जो कि उनके पास होगी डॉक्टर के पास. सो आई हैव टू गिव ऑल दिस इंफॉर्मेशन. देयर इज नथिंग that the patient will, the doctor will know beforehand. There is nothing. Yes, and in the history you can ask, okay, what kind of work do you do?
Yes. Dr. Hina?
Yes.
I need to ask, like, in this card, they have written, your patient is 58-year-old. Like, I assumed it, like, already I have all the history of the patient, and now
you don't
I have to convince him.
Never, no. The card is not about convincing. The card,
so like,
none, in this, just in the end, it's written that you have to convince the patient to undergo a testing.
Yeah, that's why we are convincing him. We're trying to.
No, but in the rest of your points, nothing is mentioned. The overview, if you just go through the card, it's not about the diabetes or you have to convince the patient for the testing. No.
First, we misinterpreted it, actually.
Yes. First, your task is to explain the reason of blurred vision. Then recommend test. Then third, explain why you think it might be diabetes. And in fourth, it's recommend to the ophthalmologist. And after that, you try to convince him. So your whole card is not for the convincing.
And every time it's like different, like not every time we have to ask the patient to give a brief history.
Exactly.
Okay, and we have to ask the name as well. Most of the